Good day everyone. Today I will present on an antibiotic named Cloxacillin. Cloxacillin is an antibiotic discovered and developed by Beacom, a British pharmaceutical company that is now part of GlaxoSmithKline. It was patented in 1960 and later approved for medical use in 1965. Cloxacillin was first introduced in England in 1962 and the United States in 1965. It is a semi-synthetic penicillin that is resistant to penicillinase, which is a chlorinated derivative of oxacillin. Cloxacillin is developed in response to the productions of beta-lactamase enzymes by Staphylococcus aureus, which inactivate natural penicillin. Cloxacillin has a molecular formula of C19H18Cln3O5S and a molecular weight of 435.88 grams per mole. Chemically, Cloxacillin contains a bulky isosaccharyl side chain R chain that is attached to the beta-lactam ring to block the binding of enzyme beta-lactamases and is resistant to degradation by beta-lactamases. Physically, Cloxacillin appears as a white crystalline powder, is odorless and has a bitter taste. In terms of solubility, Cloxacillin is soluble in water to form an alkaline solution. It is also soluble in alcohol and slightly soluble in chloroform. These properties support the effectiveness of Cloxacillin. Cloxacillin is a beta-lactam antibiotic that kills bacteria by inhibiting the synthesis of their cell walls. It works by binding to transpeptidases, which are penicillin-binding proteins, located within the bacterial cell wall, disrupting the cross-linking of linear peptidoglycan chain. This action interferes with the final stages of assembling the peptidoglycan layer by transglycosylation. Hence, this compromises the structural integrity and strength of the cell wall. Consequently, bacterial cell lysis occurs, mediated by autolytic enzymes such as autolysin and murine hydrolases. Cloxacillin targets different penicillin-binding proteins in various bacteria. For example, in Escherichia coli strain K12, it targets D-alanine carboxy peptidase DAC-A, whereas in Streptococcus pneumoniae strain R6, it targets both penicillin-binding proteins 2X and penicillin-binding proteins 1A. This concluded Cloxacillin is selectively effective against some bacteria that produce beta-lactamase enzyme. Although Cloxacillin is resistant to beta-lactamase enzymes, several microbes can escape this action. Firstly, methicillin-resistant Staphylococcus aureus (MRSA). It produces an altered penicillin-binding protein called PBP2A, which is encoded by the MAC-A gene. Besides, Streptococcus pneumoniae develop resistance through mutation in the PBP genes such as PBP1A, PBP2X, and PBP2B, which alters the penicillin-binding protein. These mechanisms will decrease the affinity for Cloxacillin and other beta-lactam antibiotics and reduce binding of Cloxacillin to the target penicillin-binding protein. Lastly, Cloxacillin is relatively inexpensive. In Malaysia, the price of Cloxacillin varies depending on the brand, dosage, and quantity. Typically, it is available in 250 mg capsule form with 10 capsules per strip. Dyna Cloxacillin, 4 ringgit and 20 cents per strip. Eufa Cloxacillin, 3 ringgit and 80 cents per strip. Pharma Niagara Cloxacilla, 5 ringgit and 50 cents per strip. And finally, Cloxacap, 5 ringgit and 50 cents per strip. Additionally, some companies offer 250 mg Cloxacillin capsules in bulk packaging, which make the cost much cheaper. That's all from me. Thank you for listening.